If you're over 60 and you've noticed your ankles puffing up by the end of the day, or your shoes feel tighter at night than they did in the morning, I need you to stop scrolling for the next few minutes. Because what I'm about to tell you is something most doctors don't explain properly in a 7-minute appointment. And by the time you finish this video, you'll understand exactly why this is happening to your body, and more importantly, when it's something to worry about and when it's not. Let me start with something that might scare you a little. Swollen legs are not always just getting older. Sometimes, yes, it's harmless. But sometimes, swelling in your legs is your body's early warning system trying to tell you that something deeper is going on, in your heart, in your kidneys, in your veins, or even in your liver. And the scary part is, most people ignore it for months, sometimes years, because they think it's normal aging. By the time they finally see a doctor, the underlying problem has already progressed. So today, I want to walk you through this properly, not to frighten you for no reason, but to give you the real, medically grounded explanation, so you know what your body is actually telling you. Let's talk about the most common reason first, because this is the one almost nobody explains well: venous insufficiency. Inside your legs, you have veins with tiny one-way valves. Their job is to push blood back up toward your heart, against gravity. When you're young, these valves work efficiently, but as we age, especially after 60, these valves can weaken. When that happens, blood doesn't flow back up as efficiently, it pools in your lower legs. That pooling pushes fluid out of the blood vessels and into the surrounding tissue, and that's what you see as swelling, especially around the ankles, especially in the evening after you've been sitting or standing for long periods. This is incredibly common. Some studies suggest a large percentage of adults over 60 have some degree of venous insufficiency, and most don't even know it has a name. It's not usually dangerous on its own, but it can become uncomfortable, and over time, if untreated, it can lead to skin changes, varicose veins, and in some cases, ulcers that are difficult to heal. Now here's where it gets more serious, and this is the part I really want you to pay attention to. Sometimes leg swelling isn't about the veins at all. Sometimes it's about the heart. When the heart isn't pumping as efficiently as it should, a condition called heart failure, blood can back up in the veins leading to the legs, causing fluid buildup. This is one of the most common reasons doctors see leg swelling in older adults, and it's also one of the most missed, because people assume tired legs and swollen ankles are just signs of being unfit or getting older, not signs that the heart needs attention. The clue that often separates this from simple venous issues is what else is happening alongside the swelling. If you're also feeling unusually short of breath, especially when lying flat, if you're waking up at night feeling like you can't catch your breath, or if you've noticed sudden weight gain over just a few days, that's not normal aging. That combination needs medical attention, and it needs it soon. I'll pause here and just say, if anything I'm describing sounds familiar to you right now, please don't wait until next month's checkup. Mention it to your doctor this week. This video is here to help you understand your body better, but it's not a replacement for an actual examination. Let's continue because there are a few more pieces to this puzzle that most people never hear about. The kidneys play a role too. Your kidneys are responsible for filtering excess fluid and waste out of your blood. When kidney function declines, which can happen gradually with age, with long-term high blood pressure, or with diabetes, the body starts retaining fluid it would normally get rid of. That extra fluid doesn't just disappear. It settles in the lowest parts of your body, usually your legs and ankles, because gravity pulls it there. What makes this tricky is that kidney-related swelling often shows up quietly. You might not feel sick. You might just notice your legs are heavier than usual, or that you're urinating less than you used to. Those subtle changes are worth mentioning to your doctor, because kidney function is something that's best caught early, while there's still a lot that can be done to protect it. Then there's the liver. This one surprises a lot of people. The liver produces a protein called albumin, which helps keep fluid inside your blood vessels where it belongs. When liver function is impaired, albumin levels drop, and fluid leaks out into surrounding tissues, again, often pooling in the legs first. This is less common than the venous or heart-related causes, but it's part of the full picture your doctor is trained to consider. Now, I want to bring up something that very few videos on this topic ever mention, and it's important: medications. If you're taking calcium channel blockers for blood pressure, medications like amlodipine, leg swelling is a well-documented side effect for some people. Certain anti-inflammatory medications, some diabetes medications, and certain steroids can also cause fluid retention as a side effect. This doesn't mean you should stop taking your medication on your own. Please don't do that. But it does mean that if your swelling started around the same time you began a new medication, that connection is worth bringing up at your next appointment. Sometimes a simple adjustment is all that's needed. Here's the part where I want you to actually pay close attention, because this is genuinely important, not just for views, not for drama. It's medically important. If the swelling appears suddenly in just one leg, not both, and especially if that leg feels warm, looks red, or is painful to the touch, this can be a sign of a blood clot, known medically as deep vein thrombosis. This is not something to wait out. This is something that needs medical attention the same day, because a clot like this can, in rare but serious cases, travel to the lungs and become life-threatening. I'm not saying this to scare you for no reason. I'm saying it because knowing this one detail, one leg versus both legs, sudden versus gradual, can genuinely make a difference in catching something early. Alright, let's take a short pause here. If this video is actually helping you understand your body better, do me a favor and hit that subscribe button right now, and tap the like button too. It genuinely helps this channel keep making content like this. Content that explains things doctors don't always have time to explain in a rushed appointment. And if you have a parent, a grandparent, or even a friend who's mentioned swollen legs or ankles recently, send this video to them. It might be exactly the nudge they need to get checked out. Now let's talk about what you can actually do, starting today, regardless of the underlying cause, because there are some genuinely helpful habits here. First, movement matters more than most people realize. Sitting or standing in one position for long stretches is one of the biggest contributors to fluid pooling in the legs. If you sit for long periods, try to stand up and walk for even 2 or 3 minutes every half hour. Simple ankle movements, flexing your foot up and down while seated, actually help activate the calf muscles, which assist in pushing blood back up toward the heart. Second, elevation helps. When you're resting, try propping your legs up above heart level for 15 to 20 minutes a few times a day. This uses gravity to help fluid drain back toward your torso instead of settling in your lower legs. Third, pay attention to salt intake. Excess sodium causes your body to retain more water, which can make swelling worse, especially if your swelling is related to your heart or kidneys. This doesn't mean eliminating salt entirely, but being more mindful of processed foods, canned soups, and packaged snacks, which often contain far more sodium than people realize. Fourth, compression stockings can genuinely help with venous-related swelling. These aren't just for athletes or pregnant women. Properly fitted compression stockings can support the veins in your legs and reduce that end-of-day puffiness. It's worth asking your doctor or pharmacist about the right compression level for your situation, because the wrong fit can actually be uncomfortable or even counterproductive. And finally, and I really can't say this enough, track it. Take a quick mental note, or even better, write it down. When did the swelling start? Is it both legs or one? Does it go down overnight, or is it there even in the morning? Is it accompanied by shortness of breath, fatigue, or weight gain? This information is incredibly valuable to your doctor, because leg swelling on its own can mean a dozen different things, but leg swelling with the right context can point much more clearly toward the actual cause. I know this video covered a lot, and if you're someone who's been quietly dealing with swollen ankles for months, telling yourself it's just age, I hope this gave you a clearer picture of what might actually be happening, and more importantly, gave you the confidence to bring it up properly with your doctor instead of just accepting it as something you have to live with. To be clear, I'm not here to replace your doctor. and nothing in this video should be taken as a diagnosis for your specific situation. Everybody's body is different, and the only way to know for certain what's causing your swelling is through a proper examination and sometimes a few simple tests like blood work or an ultrasound of the legs. But knowing what questions to ask and what symptoms to mention can make that conversation so much more productive. If you found this helpful, subscribe to this channel because we cover topics exactly like this every single week. Real explanations, no fear-mongering, just the kind of information that helps you take better care of yourself and the people you love. Drop a comment below and let me know. Have you experienced this kind of swelling yourself, or is this something a parent or partner has dealt with? I read every comment, and honestly, some of the best topics for future videos come directly from what you share down there. Take care of yourself, pay attention to what your body is telling you, and I'll see you in the next video.